I'm going to present some of the work in our Global Health Resilience team on decision support tools to enhance public health resilience in climate change hotspots. So this is a representation of the warming of global temperatures from 1850 through to present day. So here we can see temperature anomalies compared to a 1971 to 2000 baseline. And we can see that there's been a very dramatic warming of the global climate in the last few decades. And this has coincided with a dramatic expansion of vector-borne diseases such as dengue. In the 1970s, it was estimated around 9 countries had experienced severe outbreaks of the disease, and that number is now increased to over 120 countries and growing. We're starting to see outbreaks of dengue in places that were previously unaffected in Europe and in higher latitudes in the Americas. Last year, we published a study projecting changes in the length of the transmission season and population at risk of the 2 most important vector-borne diseases, dengue and malaria. And we found that if global temperatures are to continue increasing to 3.7 degrees C by the end of the century, we could see an additional 4.7 billion people at risk of these diseases. Whereas if concerted mitigation action were to be taken to keep temperatures below 1 degree C, that number would be dramatically reduced. So it's not only the warming climate that is contributing to the spread of diseases like dengue fever, also increasing volume of passengers, humans moving around the globe, and an increase in travel and trade, which can allow invasive mosquito species to be introduced into new areas. This, combined with the warming temperatures and more unpredictable and extreme events such as floods, droughts, and storms, is changing the timing and intensity of infectious diseases. Here is an example of a study we conducted recently looking at the erosion of the transmission barriers to dengue. So the cooler temperatures in the south of Brazil and the more remote areas in the Amazon rainforest were previously protected from outbreaks of dengue. But in the last 10 years, and especially this year, we've seen severe outbreaks of dengue in the south of the country. And this is partly due to the warming of the temperatures. And in the Amazon rainforest, we are seeing better infrastructure and increased connectivity to the rest of the urban network in Brazil. For example, if we take the city of Manaus in the Amazon, we can see that over a 10-year period from 2007 to 2018, the city is much more connected to smaller areas in the Amazon, where we are seeing the emergence of diseases transmitted by Aedes, along with outbreaks and hotspots of malaria transmission. So this year we published a scoping review looking at evidence of outbreaks of climate-sensitive infectious diseases following extreme climatic events such as tropical cyclones, droughts, and floods. We found substantial evidence of links between waterborne diseases such as diarrheal diseases and cholera, and some emerging evidence of links between droughts and dengue fever, for example. This image here is one of the most densely populated favelas in the city of Rio de Janeiro. And we can see that there are lots of blue temporary water storage containers within this favela. And these provide ideal breeding sites for the Aedes mosquitoes, particularly in times of water shortage. This here is an image of a temporary water storage container that was implemented in a northeast city of Brazil during drought events, and we can see the conditions inside this container are perfect for increasing mosquito populations. So following on from a study that we'd conducted in Barbados, where we'd found this interesting link between drought events and the delayed impact on the risk of dengue outbreaks, we found a very similar pattern in Brazil, where 4 months after a drought event in urban areas, we could see an increased risk of dengue, as well as an increased risk immediately after extremely wet conditions. And this effect was exacerbated in urban areas, and we found this was partially related to an increase in water shortage during droughts. So in urban areas that were reliant on the water network, when the water supply was disrupted, more households were having to rely on this temporary water storage. Whereas in more rural areas such as the Amazon, we found the link between extremely wet conditions and dengue was slightly more enhanced. So this kind of climatic indicators, so looking at the combination of short and long lag hydrometeorological indicators, can help us improve the early warning system work that we conducted several years ago. This is an example of a prototype early warning system that was put together in 2014 ahead of the Football World Cup, combining seasonal climate forecasts with data from the dengue surveillance data at the time of forecast to produce a probabilistic forecast 3 months ahead of time. And we're hoping to improve this kind of system now by using these bespoke hydrometeorological indicators depending on the geographical setting to improve our predictions and guide mosquito control activities. So here we can see an example of a schematic of how this sort of model might work in the Caribbean. This is particularly for Barbados. So we used historical records of dengue cases over a 20-year period. And we found that by interacting long and short lag values of the standardized precipitation index, we could identify different patterns that represent high risk of dengue. So, for example, if we were to observe hot and dry conditions and then had a forecast for exceptionally wet conditions several months later, then the model would produce a high-risk forecast of dengue outbreaks. Whereas if conditions were observed to be cool and dry and the forecasts were for dry conditions to continue, then the model would produce a low risk of dengue outbreaks. And we're working now to try and overcome this implementation challenge with our partners in the Caribbean, particularly in the Barbados Meteorological Services and the Ministry of Health and Wellness in Barbados, to see how we can connect a modelling tool to the climate services platform that's already implemented at the Barbados Meteorological Service. And we're exploring ways to adapt this impact matrix, which was designed by the World Meteorological Organization to represent both the severity of the disease outbreak and the confidence in our forecast at predicting that that outbreak will happen. So this year, I moved to the Barcelona Supercomputing Center from the London School of Hygiene and Tropical Medicine. And at the BSc, we have started several new projects thanks to funding from the Wellcome Trust. One of our projects is to develop a modelling tool called IDExtremes, which will produce probabilistic forecasts of infectious disease outbreaks given these compound extreme climatic events. And we're hoping to develop this model and see if it can be applicable to not only dengue, but also other climate-sensitive infectious diseases such as cholera and leptospirosis. And we're working with partners in Brazil, Barbados, South Sudan with Médecins Sans Frontières, and also in Nepal and Bangladesh with our partners in the Red Cross. We also have another project where we step back a little and to be able to build robust data sets to inform our models. So we're looking to integrate both gridded products and satellite images with strategically collected drone images and weather station data, as well as socioeconomic, demographic and health system indicators with our disease surveillance data. And we hope to develop toolkits in specific climate change hotspots in cities, in small islands, in the Amazon rainforest, and also in the Andes. This is an example of one of the drone images collected from one of our sites in Loreto in the Peruvian Amazon. And these kind of images will help us develop some machine learning algorithms to improve the way the coarser scale satellite images represent the land use and how people may be changing the way they store water and the availability of breeding sites depending on extreme climatic events in these particular sites. So we also have another project funded by Horizon Europe. This is called IDEalert, and this project is looking to build climate resilience to emerging health threats in Europe and beyond. So we're working to integrate both the IPCC framing of risk in terms of hazard, exposure and vulnerability with the One Health approach to model in an interdisciplinary framework interactions between environment, animal and human health. And we are working in particular hotspots across Europe, in Spain, in Greece, in the Netherlands, in Sweden and also in Bangladesh to try and develop some robust systems to resist epidemics of zoonotic diseases. And we also have another project focusing specifically on mosquito-borne diseases, both in endemic and epidemic settings, building on some previous project that we developed, funded by the UK Space Agency with HR Wallingford and the Met Office, to develop an early warning system which is operational now in Vietnam. So through this project, we're hoping to develop this for other countries in Southeast Asia, and also to link the kind of modelling that we've developed in these endemic settings with citizen science and smart trap data in places in Europe where we can see the emergence of these diseases to try and improve our epidemiological intelligence on these issues. If you'd like to learn more about these kind of projects, you can watch this short video produced by the Royal Society featuring some of our projects in Europe and Latin America. And I just want to quickly plug the launch event of our very first indicator report from the Lancet Countdown in Europe. So some of you may have heard of the Lancet Countdown initiative. It's a global initiative tracking progress on health and climate change across 5 different domains, including impacts, adaptation, mitigation and co-benefits, economics and finance, and political engagement. And last year we launched our European Centre, and we have our first indicator report that will be published tomorrow evening, alongside the global report, where we report 33 different indicators published by 44 experts across Europe. And if you'd like to attend the launch event of our Europe report, then please do sign up, and we would look forward to seeing you there. And if you want more information about our launch events, then please follow the Lancet Countdown Europe on Twitter. Thank you very much.
Thank you very much, Rachel. That was really eye-opening, the scope and the breadth of the projects you're involved in. I think the Royal Society summarized that very well: computer versus mosquito by Professor Rachel Lowe. And we'll, of course, be keeping an eye out on that really important launch tomorrow, and particularly the indicators that you mentioned. So thank you very much for sharing with us all of your approaches, and we're looking forward to hearing now a little bit more about other projects in your team. So I'll quickly hand over to Dr. Raquel Lana.